Klor-Con M10 is a mineral supplement that is used to treat or prevent low levels of potassium in the blood. It is important to have a normal level of potassium in the blood because it helps your cells, kidneys, heart, muscles, and nerves to work properly. Most people get enough potassium by eating a well-balanced diet, but there are certain conditions that can lower your body's potassium levels, such as severe prolonged diarrhea and vomiting, hormone problems like hyperaldosteronism, or treatment with water pills/diuretics. The daily dosage and timing of Klor-Con M10 will depend on your specific condition and needs, so it's important to follow your doctor's instructions. It's best to take this medication with a meal or shortly after eating. Be sure to take it exactly as prescribed by your doctor to get the most benefit from it. When taking Klor-Con M10, make sure to follow your doctor's instructions. To avoid stomach upset, take the dose with a meal and a full glass of water, unless your doctor tells you otherwise. After taking the medication, do not lie down for at least 10 minutes. It's important not to crush, chew, or suck on the tablets, as this can release all of the drug at once and increase the risk of side effects. If you have trouble swallowing the tablets, you may break the tablet in half and take each half with a glass of water. Another option is to dissolve the tablet in a half glass of water before taking it, making sure to stir the mixture for 30 seconds and then drink all the liquid. Repeat the process to ensure you are getting all of the drug. Only use water for mixing, and do not prepare the mixture ahead of time. If you have any questions, consult your doctor or pharmacist. Take Klor-Con M10 regularly at the same times each day to get the most benefit from it. The dosage is based on your medical condition and response to treatment. Do not increase your dose or take it more often than prescribed. The recommended maximum dose is 20 milliequivalents per dose. If your condition does not improve or if you experience symptoms of low potassium in the blood, such as irregular heartbeat or muscle weakness/cramps, be sure to inform your doctor. Some common side effects of Klor-Con M10 may include upset stomach, nausea, vomiting, gas, or diarrhea. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's important to contact your doctor immediately if you experience difficult or painful swallowing, or if you feel as if the tablet is stuck in your throat. Seek medical help right away if you experience symptoms such as vomit that looks like coffee grounds, stomach/abdominal pain, or black/tarry stools. While serious allergic reactions to this drug are rare, it's important to seek medical help right away if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, it's important to contact your doctor or pharmacist. If you are in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Klor-Con M10, it's important to discuss any allergies with your doctor or pharmacist, as this medication may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have heart problems, kidney problems, or high levels of potassium in your blood. If you have a history of stomach or intestinal ulcers, it's recommended to take a liquid form of potassium instead of sustained-release products. Be sure to inform your doctor or pharmacist if you have any throat, stomach, or intestinal problems such as blockage, narrowing, or ulcers. Before undergoing surgery, make sure to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's important to consult your doctor before using other potassium supplements or salt substitutes that contain potassium, as too much potassium can cause serious side effects. This is especially important to consider during pregnancy, as the risks and benefits of using Klor-Con M10 should be discussed with a doctor. Additionally, if you are breastfeeding, it's important to consult your doctor before using Klor-Con M10. It's important to be aware of potential drug interactions when taking Klor-Con M10. Make sure to inform your doctor or pharmacist of all the medications you are currently using, including prescription, non-prescription, and herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. If you are regularly taking other medications that can also raise your potassium level, such as drospirenone, eplerenone, ACE inhibitors, angiotensin receptor blockers, or potassium-sparing diuretics, it's important to let your doctor or pharmacist know. Additionally, it's important to inform your doctor or pharmacist if you are taking medications that can slow down the movement of potassium in your stomach or intestines, as this can increase the risk of side effects. Examples of these medications include atropine, scopolamine, certain antihistamines, antispasmodic drugs, bladder control drugs, and certain drugs for Parkinson's disease. If you suspect an overdose and the person is experiencing severe symptoms like passing out or having difficulty breathing, it's crucial to call 911 immediately. Otherwise, reaching out to a poison control center is important. In the U.S., residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Symptoms of an overdose may include irregular heartbeat, muscle weakness, and confusion. It's important to seek help as soon as possible in these situations. It's important not to share Klor-Con M10 with others. While taking this medication, it's important to have regular lab and/or medical tests to monitor your potassium blood level and kidney function. Make sure to keep all medical and lab appointments and consult your doctor for more details. In addition to taking Klor-Con M10, it's recommended to eat a well-balanced diet. Foods high in potassium include bananas, oranges, cantaloupe, raisins, dates, prunes, avocados, apricots, beans, broccoli, spinach, potatoes, lentils, chicken, turkey, beef, and yogurt. It's best to consult your doctor or dietitian for recommended foods. If you forget to take a dose of Klor-Con M10, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take your next dose at the usual time. Don't take a double dose to make up for the missed one. When it comes to storing Klor-Con M10, it's important to keep it at room temperature and away from light and moisture. Make sure to store it in a place that is out of reach of children and pets. It's also important to not flush the medication down the toilet or pour it into a drain unless instructed to do so. When the medication is expired or no longer needed, make sure to properly discard it. It's best to consult your pharmacist or local waste disposal company for the best way to dispose of it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.